disjointed, fragmented care that Jigar is talking about, the increased amount of administrative burden, the complexity of the 340B program, the lack of payer and market access, which all negatively impact patient outcomes. So at Longitude Rx, our mission is not only to help and support the health systems and their specialty pharmacies, but also to remove the barriers and have solutions for those pain points that lie between the patients and their life-saving therapies. That's why at Longitude Rx, we are partnering with Innovaccer to create a platform that is solving for these pain points by creating an end-to-end solution, not these pointed solutions that are, again, contributing to this fragmented care. What we want to create is an end-to-end solution that allows patients and prescribers to see their prescriptions and to automate a lot of these processes and unify the disparate data.
No, Shilpa, great answer. And there are so many nuggets in what you said that we would love to get deeper into. But the first point of it, right, by the health systems, for the health systems, there are very few companies that can make that comment. And this is like such a unique kind of structure. So tell me a little bit more and our audience about that. How's this structure panning out for you guys? Is it like a true partnership that is being talked about? And what are some of the things that are working in your favor in this current setup?
Yeah, definitely. So, you know, if you look at our structure, we're not only owned by the nonprofit health systems, but the CEOs of these health systems are the board members that really govern the operating company, which I think is a very unique model. Our mission is focused on addressing the gaps that other vendors have not been able to address. So as Shilpa kind of stated, we're truly bringing the health system expertise, but really investing capital in a way that hasn't been done before, right? So really looking at this from a perspective of solving health system problems very differently than has been tried before. Of course, with partnerships like the ones with Innovaccer, we're going to be able to accelerate that work. And we truly believe we're taking the expertise from the health system side and taking the expertise in the technology side and really bringing a solution to the market that is going to help address those gaps in a very different manner than what other vendors have tried to do. Shilpa kind of pointed out there's a lot of different vendors trying to solve different problems that health systems face today. But what often is missed really is that impact that is not felt on the health system side, right? There's always a gap or missing impact, and then you're also helping then build equity for someone outside of that health system space. So we're really trying to solve that problem collectively and really come up with a solution that meets those needs of our health system patients and our population.
No, this is amazing. And I can just imagine you said the CEOs of those health systems are on your board and you regularly talk to their chief financial officer, chief strategy officer. So it's not just a tech solution or like even a workflow solution you're talking about. You are trying to drive real outcomes for your customers right from day zero. And I think that makes it a huge difference, because for most of the CEOs and CFOs that we talk to, they talk about all the time that there is a ton of technology out there, but if you cannot drive those to outcomes, then what's the point? I think with Longitude Rx, the fact that you can drive them to outcomes in such a short period of time is something which is rarely seen. And like, again, it brings in that spatial kind of amalgamation, if you will, of a subject matter expertise of having been inside the healthcare ecosystem, been in a specialty pharmacy space, seen what kind of challenges are there, and then merging it with the right set of people, process, and technology to bring about that change. But at the same time, ensuring that, because healthcare systems today are under huge pressure as we speak, and something like this then becomes an easy yes button for them in terms of if you can drive them to the relevant outcomes that they're looking for. So again, I know that you guys have had a shortish journey, but like in a 10-12 month kind of a period, the kind of ramp up that you guys have achieved is like amazing. And like getting that level of net promoter scores or NPS, what we talk about, or the CSAT is unparalleled. So you would want to talk a little bit about the satisfaction and like outcomes that some of your customers, which is these health systems, what are they finding?
Yeah, I think, as you pointed out, our mission is aligned with the health system's interest, and it's unlike sitting outside of the health system as a vendor coming in for our own interests. Our interest really lies in the patient care. So what our health systems are finding is that we're really sitting at the table with them and designing, utilizing our expertise and driving that strategy, looking at the data and doing the data analytics and having actionable insights and providing that to the health system, but listening to the health systems, meeting them where they are, and helping them create a solution that works for them instead of coming to them with a solution that may not be applicable to them. Because from the outside view, we can all say, oh, I know what the solution will be, but how do you embed that solution? How do you utilize their resources? Where are their strengths and where are their weaknesses, and how can we help them in that way? I think that is really resounding with our health systems, and the feedback that we get from them is that it's incredible that you guys brought these ideas and we thought, okay, how is that going to happen? But you guys are actually providing action behind those ideas as well, and listening to our needs to make this happen.
Makes sense. And let's talk a little bit about this space as well, the specialty pharmacy space, specifically focused on the 340B kind of an arena. Give from your perspective a lay of the land in terms of what are some of the top pain points that you are seeing with your customers, what kind of vendors exist today in the space, whatever that you can share which is non-confidential in nature for our audience, but just give the lay of the land a little bit as to how you see it.
So specialty pharmacy is a growing market, right? So I think it's estimated to be around a $400 billion market, but let's just call it that nearly half of all prescription spend comes from these specialty medications. If you look at the FDA pipeline, really 85% of the pipeline, believe it or not, is considered specialty medications. So what's happening is more and more of these complex medications are being approved by the FDA. They're coming to the market from the pharmaceutical industry. What's happening also in the space at the same time is, again, as I stated previously, it's really the health system side that are seeing these patients who are actually being prescribed these complex medications, right? So they're really seen at those high-level, high-tiered programs, clinical programs. So what we've done is really think about this really holistically from a patient's perspective, and really seeing that the patient is getting this diagnosis at the health system. They're really getting prescribed these medications at the health system. But then what's happening is their care is then getting fragmented. And when they do that, you know, that would be okay if that care was very well coordinated. But what's also happening, as kind of Shilpa was alluding to earlier, is as that care leaks out of the organization, it starts getting fragmented. Patients are left without any answers. They experience financial toxicities. They're not able to pay for their medications. They are, you know, fighting the delays in prior authorizations. You know, there's challenges in adhering to those medications because they may experience, you know, clinical toxicities as well. So there's, you know, all kinds of issues that these specialty medications are presenting. But as I just mentioned earlier, the market is, you know, these specialty meds are in the market. Patients, most of the patients that you encounter are likely on a specialty med. So, you know, what our mission really is to coordinate this care really in a seamless manner, so that when that patient is prescribed that medication, the health system, the provider side, you know, the medical staff office, everyone really is aware of what that patient is getting and when they're getting it.
Everybody has a negative impact. So these pain points have a negative impact on the patients because they have delayed therapies impacting their outcomes. You have providers that are overwhelmed and consumed by these complex and non-transparent processes and paperwork that takes them away from their clinical care. You have health systems that are also negatively impacted because they may have financial leakage by lost prescriptions to external pharmacies and losing care of the patients, which is at the core of all of this, is that you then have disjointed patient care. And I can speak from personal experience, having been an oncology pharmacist, being at the bedside, being able to prescribe prescriptions, having to do then a prior authorization, appeals, waiting for patients to get life-saving therapies. and how much of a clinical burden that takes away from patient care, which is at core. And then if the prescription's not able to be filled by the health system pharmacy, then you have no transparency of what is happening to that prescription. When a prescriber prescribes a specialty prescription, they are expecting that the patient is probably going to start the next day, right? So when you have a follow-up, they're making clinical decisions assuming and based on the fact that you've had this amount of therapy. So that is an issue. Then second, when it leaves to an external pharmacy, we do not have control over what that prior authorization may be, what was the result of the prior authorization, who's working on the appeal, and they're faxing it to the health system, and now faxes are lost. Now there's further delay in therapies. So if you can imagine all of these workflows that require a manual process that get lost to external pharmacies, that disjointed care is not just painful for like a workflow perspective, but that negatively impacts the patient. And what we want to do is unify all of that into one process, automate these processes to give the prescribers and the care teams time back to their patients. And also allow patients to have a more personalized care. And we can speak more on how we're going to do that, but that really the patient care is at the core of all of this.
This is great, and from the way that you are telling me, it sounds like a win-win-win kind of a strategy, because at the core of it, the patient, which otherwise a lot of time, not just the patient, but the family members also are left confused a lot of times, because suddenly you have a great relationship with your provider in your doc, and now you're left to figure out after once you've seen the doc, everything. Like having been on the bearing side myself as a family member, it feels like, oh, my doc doesn't love me anymore, or what happened that they left me to figure it out?
It's not a perfect system, right? You have your patient is being told, you're gonna get this prescription at X pharmacy, and then the patient and the family member are waiting, but it's not filled at X pharmacy, it's filled at Z pharmacy, but who's gonna tell the patient it's going to Z pharmacy? And then the whole clinical care team assumes they sent it to X pharmacy, but it's being filled at Z pharmacy. So who is communicating with them? So it really, really is a big issue that we really want to solve.
And there's a financial assistant module as well. Talk a little bit more about that piece as well, because for a lot of patients, not only they're dealing with these life-threatening diseases, but they also probably do not have the finances to get that in order. So how will that come together in the solution that you guys are thinking about?
Yes, and Jigar actually highlighted this point about financial toxicity. So of course, these specialty medications, they require this expert close coordination because of the complexity of these drugs and potential side effects of these drugs. But outside of those side effects, you also have the financial side effects because these are expensive medications. And at the moment, there is no great solutions on figuring out, or one solution in figuring out how to help patients get financial assistance. It requires deep knowledge that our team has of knowing where to go and how to get patients to apply to certain grants or foundations to give them financial assistance. But that's another tool that we are trying to embed into our platform, is the assistance with financial navigation for these patients to be able to afford these medications and not have a delay in their therapies, right? Can they afford the next round of therapy? Well, we want to take care of that so they don't have to worry about that.
Yeah, no, great answer. The one thing which is there is that this solution helps obviously the patient, it helps the doctor or the caregiver, but it's also very helpful for the administrator which is sitting at a health system kind of a level, right? Because for most of these not-for-profit health systems, especially with the HR1 regulation coming in, a lot of them are seeing a significant kind of drop in their revenue. Like I was with one of our customers just as of like a couple of weeks back, and he was saying that they are facing a 7.5% reduction in the net patient revenue because of the Medicaid kind of billing shortages and everything, right? Now, I know that specialty pharmacy is a big part, as you said, as a part of each of these health systems that are there. So from a financial lens perspective for the CFO that are listening to this, how does it have an impact on their top line as well as the margins and EBITDA that they are focused on?
Yeah, great question. So number one, I think you touched on this earlier, the 340B program is essential for a lot of these health systems, right? So it helps them, the mission of the 340B program was to really help all of these nonprofit health systems stretch the scarce resources that they have, right? So I think that's an absolute must. I think the other thing is you always see the 340B program really in the headlines, right? There's different regulations, there's different ways to adhere to the program. There's always changes in the way it's interpreted. And so what health systems are facing is a lot of different moving complexity, and they need to be able to respond to it quickly, right? So complying with the 340B program is really, really a tough task for a lot of these health systems if they're not staying really abreast of what the issues are and being able to respond with technology and tools to stay compliant in that manner. And then I think the second aspect of what you touched on is the financials, right? Specialty pharmacy really represents a diversified source of revenue for health systems. These are patients that are being seen in your health system space. These treatments are very, very expensive, but also are tied to revenues that are leaking out of your system, right? So especially if you're doing all of the work, upstream work related to those health systems, you're seeing the patient, you're diagnosing their care, there's being seen in your clinical setting. It's another portion of the revenue generation that can really be looked at by CFOs. Yeah. So that ties that win-win across the board, that not only you're helping the health system, the patients integrate their care within the organization, but you're helping these health systems retain the financial piece so that they can continue to assist those patients in those complex conditions, right? So a lot of times the things that Shilpa touched on, all of the things that we just talked about require a lot of resources. Yeah. Health systems are also burdened with a lot of these administrative tasks. And I think where AI, automation, where Innovaccer and companies like Innovaccer are really able to help is really tap into easing that burden and tap into being able to ease these administrative burdens. Clinicians are experiencing today, as we all know, is really this increased administrative burden, increased burnout as a result of all of the different tasks that are required to really meet the needs of these health system patients.
No, I couldn't have said it better. And like at Innovaccer, that's our core belief that if you talk about AI in general, that's the only way that you can really help your customers in terms of there's a significant pressure as we have seen from the external environment and like all these kind of regulatory kind of like, I would say, uncertainty is not helpful to anyone, and AI can help you over there because then they can ensure that every person which is there in your health system is performing at the top of their license, and you're getting the maximum kind of like impact from the work that they are doing, and at the same point in time ensuring that your clinicians are spending the time that is humanly. At the same point in time the caregivers like are doing the stuff that they got into the healthcare for the first place, and your patients are getting a much better kind of an NPS and a CSAT after. I know those terms are foreign at times, but are really the way that we should be thinking about our patient and the caregiving at the end of the day.
So the health systems themselves do understand the pain points that they have. They actually may also know the solutions, but as to Jigar's point, it requires a lot of effort and it's a very heavy lift to then put in solutions for all of those problems that we've pointed to. So they're really looking for such resources to help them. And it's not just, building the technology, but it's really trying to build it in the perspective of having also been in the health system and knowing the problems. So trying to build those solutions, working with health systems also to customize some of those solutions. There's going to be standardized processes that occur across prescriptions that can be scaled to all health systems, but then also understanding where their needs are as well, and also keeping a human in the loop, right? We need to continue having them be involved, and experts such as our team in Longitude Rx being involved with the technology. And I think that really adds to it, other than just having point solutions or technology just to add technology in there. That's not the purpose of this.
Makes sense. And you talked about prior authorization as being one of the steps which is kind of broken or missing in the current kind of setup. So when you were talking about all these leakages that are happening in the current kind of an ecosystem, how big a problem is that? Like, I know that from a provider and a payer kind of a relationship perspective, most of these payers have now adopted AI in a fairly aggressive kind of a manner. And what's happening is that it's that they're rejecting claims like they're not rejecting more claims, but they're rejecting it faster. Now what that happens is that because of it, as a health system, you have to now wait much longer to get that approval in the place. And for that reason, most of these health systems are looking for a vast or a wide array kind of a prior auth kind of a solution that can help them. But you were talking a lot more about that, how the lack of prior auth in the specialty pharmacy space means a lesser kind of care or like lesser quality care that's being delivered, and it also means that the patient is at the end of the day has to go into the network, out of network at times, and like have a financial kind of burden as well as a care burden. So talk a little bit more about that.
There's a lot that is associated with prior authorizations themselves. So prior authorizations have historically been a bottleneck and continue to be so in patients getting their therapy on time. And it's a real burdensome also for care teams that are trying to provide these medications on time. So essentially what happens with prior authorization is that a patient is prescribed a specialty medications and the insurance will determine whether a prior authorization is needed or not. Mm-hmm. And being able to submit the information accurately with knowledge in the first step can improve your success rate of that prior authorization. Mm-hmm. So that's step one, is knowing how to submit those prior authorizations. But submitting of the prior authorization themselves can be very time consuming. Mm-hmm. So we want to automate that process. And we want to also improve the success rates of those prior authorizations from the beginning. Yeah. Because what happens is if that prior authorization is denied, now you may need to contact that insurance company, which is time consuming, or you may need to give an appeal, which requires the clinician to write a letter for the medical necessity of that medication and why that medication is appropriate for that patient. Yeah. And I will tell you that appeals in themselves are quite deterring because of the time investment. So what can happen is there is a higher abandonment rate of those medications. And now the patient is worried and they're saying, okay, well, maybe I just have to pay out of pocket. Yeah. Now we're talking about hundreds, thousands of dollars out of pocket cost. And now you have to have financial assistance to pick up that cost. So as you can see that although it just might be one step, it has a negative impact downstream to all the other steps.
So Jigar, we were talking about that, how this is a true strategic partnership even for your health system customers, right? Because if you look at the entire array of, let's say, this health system and vendor partners, whatever you want to call them, a lot of them are structuring their deals in a way that, okay, you know what, there's a flat fees and then the ROI is always to be determined in a 12-month, 18-month kind of a period. What I personally found very intriguing about the way Longitude Rx does business is that you are telling your customers that only once you have generated the first dollar out. So again, there is a lot of great outcomes they will achieve in terms of better kind of like patient care, patient satisfaction, like your clinician satisfaction, but you are actually getting paid only once the health system makes the first dollar out. So talk about that engagement from a financial perspective.
Yeah, definitely. I mean, we don't just say we're by the health systems for the health systems. We truly try to live within that mission. So one of the pain points that we saw early on as we were designing our Longitude Rx operating company was that these health systems did not like giving their revenue away and not seeing the impact, right? And a lot of times CFOs will make decisions on vendors, but then they don't end up seeing an actual bottom line impact, right, from what the promises were from that vendor. We wanted to make sure that is not us from the get-go, right? So one of the main things that we do even in our contracting process, we ensure, as you said, that we ensure that the health system is making impact, making a margin on the work that we're implementing for them. And only then Longitude Rx would get paid. And we're so confident in the work that we're able to go at risk really because we want to have that health system, really see the impact. And I think that also, again, speaks to our ownership structure, being owned by non-for-profit health systems, really wanting, truly believing in the mission of why specialty pharmacy really needs to stay within the health system model, because it essentially is good for the patient, right? Because that's where the patient is receiving the care. We're wanting to make sure that it's fully integrated. And again, it all ties back to the patient.
No, this is great. And as Innovaccer, we were so excited just to hear about the vision and the mission that you guys are driving, but also the financial impact that you're able to drive for each of the health systems. Because when I say this, that there are very few kind of companies that can go at risk to prove an outcome. Many have tried it in the past and not succeeded, but even like the quick kind of runway that you have had now over the last 10 months, like there are really companies that can talk about that kind of success. So again, kudos to the team at Longitude Rx. You guys have built up an amazing kind of team, as well as you got an amazing support from your patrons, from your investors, from your customers. So this is an exciting journey that we are together going on. All right, now like quickly pivoting to the point of like the platform itself and your choice of all this technology, because I'm sure that over the last year or so, you would have like talked to what, 20, 30 kind of companies, and a lot of them point companies like that. But like we are lucky to get your, obviously there trust and the partnership at the end of the day. But tell us a little bit about what went through that decision making and what did you find in the space out there? What did you like about Innovaccer? I know I'm throwing a bunch of questions, but we'll go through each one of them. But just walk us through the process that you guys adopt.
Yeah, I can start. So you're right, we assessed over 20 different companies in the market. I think it actually gave us a really good chance to learn about what is present in the market. And what we saw was, a lot of different efforts, right? Solid efforts going behind solving the specialty pharmacy problems that health systems face. No doubt about it, right? A lot of companies are doing a lot of great work in different areas of specialty pharmacy. But we really didn't see a solution or capability that is able to really, grow with us and be able to scale with us. And obviously with Innovaccer, we saw a company that was just, so large and, involved in so many different things that we saw a real future and a real synergy in the type of work that you guys are trying to do. I think Innovaccer is, very involved in population health management, value-based care, and we really saw synergy there. So this is not just about helping really health systems capture the value of specialty pharmacy, but it really goes beyond that, right? I think as we go farther in our journey, we really thought about where this could go in terms of a partnership multiple years down the line. And where we really see it is not only helping health systems capture that financial value within the health system space and increase their enterprise value as a result, but really improve the total cost of care. And I think there's a natural synergy there that if these health system patients are able to adhere to these specialty meds that they're prescribed, if the care coordination occurs seamlessly with the help of that technology platform, I think we're going to, really see a value in the total cost of care like we've never seen before, right? And I think, especially given the innovations in the pharmaceutical industry these days, I mean, a lot of these medications are actually curative in nature. So a lot of, improvement in, lifespan, improvement in longevity has really occurred because of this innovation from the pharmaceutical industry. And we really see the technology platform really being a backbone to be able to not only partner with the payer side and improve on total cost of care, but really even with the pharmaceutical side. So if you think about the scale that Longitude Rx already has, and the health systems that are already part of Longitude Rx, we're starting to cover a significant amount of ground nationally with the systems that we have. Right? And so if you think about the data capture and the value that we can create even for the pharmaceutical industry, I think is going to be another innovative approach to being able to access medications very differently in the future. And really to be able to do that, you need a technology backbone to be able to not only aggregate the data, but curate it in a manner that is really needed by the pharmaceutical industry.
So Innovaccer had what we were looking for in terms of the capability
the ability to accelerate this build process and to really scale it. Not only do our visions kind of align and how we want to do it, but we know that there is capability of unifying data, this disparate data, because we know that data is very powerful.
For many reasons that Jigar has already
Spoken about, and how we can leverage that data to also unlock like market and payer access to get those medications for patients at their health systems. Unifies the data, automates those processes that we talked about, like prior authorizations, and we can also utilize that data to drive actionable insights for our health systems.
No, that's great. And as we said, right, this is a strategic partnership in terms of like, even from our standpoint at Innovaccer, and Jigar, you correctly pointed out, so we have been solving the value-based care problem for our customers for a very, very long period of time. However, if you think about it, value-based care, whether you are in favor or against, is still like 20% of the population, 15 to 20% of the population, which are under some kind of an at-risk kind of a contract. Now, when we go ahead and deploy in our customers, and we got 125 plus enterprise customers, like for example, Kaiser is one of it, Trinity is another, Ascension and so on, the list goes on. The challenge that ends up happening is that we have to deploy our platform, which is Gravity, and Gravity needs access to data, which we get, right? So that's a very heavy lift we have to do to provide only one outcome for the customer, which is in the area of value-based care, and 20% of the population is covered. So when we got and heard about Longitude Rx, it was like music to our ears, because we were like that, okay, you know what, now for us, for our own customers, we can provide so much more value, because the heavy lift of bringing the data into the Gravity platform has been done. There is more data types that we have to bring in, but it's an incremental process rather than a foundational setup that we have to do. So with an incremental setup for our customers, we can then go about saying that, okay, in the specialty pharmacy space, this is how we will bring you better patient care, better compliance, and better ROI at the end of the day. So that's where this relationship just made so much incredible amount of sense that it was like, okay, both feet in, just jump in and get the journey started. So thank you guys for selecting us. And one piece more that I would love to talk about is, you guys talked about the point solution journey versus a systemness kind of journey, right? For a lot of your customers, they would be using some point solutions already, right? To the chief pharmacy officers that are out there that are working in their own health system, they would have different aspects of it. So when they're evaluating this decision, how should they think about it? Should they think about it like a whole replacement kind of a process, or will you meet them where they are kind of an approach? So talk a little bit about both. Can you meet them where they are, because they might be doing some things already great, as well as talk a little bit about the systemness versus the point solution.
Yeah, maybe I can jump in here and I'll let you, Shilpa, add here. But I think this is a topic that we're very passionate about. I think we've been in the specialty pharmacy space. We've worked in health systems that have operated very robust specialty pharmacy programs, right? So no matter how robust health systems pharmacy program is, or no matter kind of, even if they're on one EMR like Epic, right? What tends to happen is there's still multiple different point solutions in place, right? Your 340B program is usually managed by a TPA within your health system. Your financial assistance has separate needs to get data from and connections from outside vendors, right? Prior auth, we just talked about, there's multiple prior auth solutions out in the market. So you may either have, what Epic is building, or you might have some other prior auth solutions that are out in the market, or you may not have anything at all and you're doing prior auths very manually, right? And so when you look at all of those different aspects of the patient journey, you're talking about multiple kind of points of entry. You're looking at your pharmacy management system on top of that. That may be a different system that actually helps you dispense those prescriptions, right? And oftentimes, when we talk to health systems, no matter the streamlined EMR, they still have multiple solutions in place, right? And what that also does is it creates these silos in terms of the work that is happening, right? So even if the specialty pharmacy team is well coordinated, there's lack of data visibility to that team and a lack of really monitoring that patient and the patient journey holistically, right? So when we say holistically, we're talking about not just, ensuring that you're able to capture a prescription at your health system pharmacy, But even when that prescription for a payer reason or you know, patient preference reason has to go to an outside pharmacy, that's okay, but you need to be able to have visibility towards it, right? Your provider, as Shilpa had stated earlier, has to have visibility towards it to see if the patient actually got the medication, they were able to afford the medication. And so that data visibility is key. And really, we don't see you know, specialty pharmacy programs having that data visibility. So what we wanted to solve with Longitude and Innovaccer together is really create an end-to-end solution that provides a holistic patient management that is connected with all of the different data points that we just talked about, but also is connected with the payer PBM side. So that you're actually you know, gaining the full visibility of that prescription, how that patient is being managed end to end, and really be able to, you know, make sure that the patient is adhering to their medication when that refill is due the next month. And really, there is not a platform we saw in the market today that actually has that capability.
And when we were doing RFP, we did speak to companies that have point solutions, and they may be good point solutions, and health systems may actually have them embedded in them. And that's okay, and from what your question was and how our approach will be, it's that problem becomes that although these might be effective point solutions, again, they're fragmented. The advantage of really utilizing this platform is that you have all your point solutions in one, there's no fragmented care, and we also have our experts and humans in the loop to help with that. But if the health systems have a point solution already embedded in there, we do want to go and see how we can work with that solution. Are there APIs that we can connect with that solution to still support that health system with other solutions that they may not have?
Yeah, no, that's great. So meeting with the customer is so important because it's not so disruptive. It is an innovative way to look at the problems they have at hand and really finding a better solution. So great. Now, I know that we can go at hours talking about this area. I'll try and do a quick kind of a wrap up now. So as we close out for the evening today, probably one question for you, like as you look out into the future, let's say 3 years from today, what would your vision be? What would be the outcome that we would have achieved together in this relationship? And if you had to have that kind of a glass and look through it, what would you see?
Yeah, I would say having a network of health systems that have really, you know, joined behind this mission of helping health systems, the health system patients, essentially navigating this, you know, specialty pharmacy journey in a much better form, right? So I think we're going to need that scale. You know, although we already are at a great starting point, we're going to need a scale of health systems to really be behind, you know, this mission of solving the specialty pharmacy patient journey.
Makes sense. So if I have to zoom out and think about what you're saying, Jigar, is let's say 3 years out, have let's say 100 plus health system who are creating a network of innovation in this specialty pharmacy kind of a domain, and they're backing pretty much this kind of like setup where not just the people and the process, but the technology is also something which is unifying them. They are cross-learning and they are improving not only the outcomes they're trying to achieve, but also the equity value in this kind of a setup. Well, this has been a great kind of a session talking to the both of you, and thanks for taking out time today for our audience. And yeah, you will see more of us in the near future. Thank you.
Thank you so much.